Number 6, action of ELCURE therapy. Disease progression, cell stress, and mitochondrial dysfunction, and decreased cell membrane potential, decreased microcirculation, accumulation of lymph slots, inflammation, edema, fibrous tau band. That is vicious cycle of disease progression, and ELCURE can help every step of this disease progression. So, action of ELCURE therapy, we can see mitochondrial dysfunction means discharging cell. Then we can help, ELCURE help production of ATP increase 500%. And decrease the cell membrane potential. Number 2, discharge cell impaired metabolism making the ELCURE can making electrically cell charging. And then number 3, decrease the microcirculation, contaminated environment, enhance microcirculation. So it helps secrete waste product. And next, accumulation of lymph sludge, electrically insulated, block the transmission. It is redistribution of ion thoraces, and melting lymph sludge. Edema, swelling means decreased microcirculation, and then ELCURE can help edema absorption and fluid shift. And then inflammation, fibrosis, tau band, and dirty environment means very bad environment, and then ELCURE can act as a bactericidal, kill the bacteria and the fibrinolysis. So fibrinolysis is, I treated ELCURE therapy about 7 years, and then every doctor's about, it's almost impossible to solve the problem of fibrosis, but ELCURE can release the fibrosis. So cell charging is, we are using alternative current and the cathode and anode, and then alternating current. Normally the electrophysiology, normally the charging concept is come from the just only direct current, but the alternating current can also charging, because that is very, very high voltage. That is, I argued with the engineer and me, how can they charge the cell by alternative current? But I insisted on that is the high voltage alternative current can also charging, because plus minus, and then it shifts to the ions, and then it became charged. That is the argue point, but the clinical results showed that good charging system. So I can tell the AC also, high voltage AC also can charge the cells. Likewise, and then the upper part, the green part is the lymph sludge, and it becomes small particle because ion thoraces, and then become charged the cells. Likewise, if you have got ill, you feel pain, if you charge, the pain disappears. That is the ELCURE effect, pain relief. Cell charging is pain relief, and then get away of the disease. Number 7, what's the difference between the traditional, conventional electrophysiotherapy and ELCURE? ELCURE therapy is most important one is high voltage, H. H means high voltage, means around from 1000 to 3000 voltage. And then it acts as electrical cell charging effect. That is the main two differences. You can see the most of electrophysiotherapy machine device is dynamic pulsed current use, but ELCURE use continuous sine wave current use, and the power of current is 50 to 150 microampere, but ELCURE is more stronger than under 1 milliampere. And you can see The most of electrical device use 50 to 220 voltage, but ELCURE therapy is 1000 to 3000 voltage. That is the main difference. Conventional therapy machine focuses muscle contraction, but ELCURE is ionization. Many focus to muscle, but the ELCURE is very deep, 10 to 15 centimeter deep, and then it becomes charging effect. But conventional therapy has no charging impact. It just give the stimulus and the contraction and relax. Contraction and relaxation. So it's very good for maybe effective to the muscle spasm or muscle pain, but the another pain, there is no effect at all. But ELCURE therapy can make the cells become very vivid and healthy. So its application is very wide. Its indication is very wide. That is a good main differences. So comparison of electrical therapy devices. The target is conventional one is muscle. ELCURE is everywhere, every cells, making charging by iontholysis, and then repeated therapy. The therapy is repeated long time. Cell can be regenerated. The nerve regeneration is impossible, but repeated treatment of nerve, it can be regenerated. Number 8, ELCURE diagnosis of pain. My theory, Dr. Sim's theory. Electrofriction is a doctor's point of view. Electrofriction, patented. Electrofriction is a medical device, and when the probe was contact to the skin, moving up the skin, the electrofriction feel by the doctor's hand, and then can hear the friction sound as if the disease progress and the pain is very severe. The friction sound is very big, and the friction power is also very big. The normal part, there is no friction. It's very smooth. Electrotraction, the cell point of view, electrotraction is the attracting the electron from the device. Is a similar concept between electrofriction and electrotraction. Many pain clinic ask the patient, to see this chart and then which level is your pain. Doctors evaluate the patient pain level by subjective judge. But ELCURE, pain cure, is by the doctors. So pain feeling doesn't matter. And then we can feel the friction power, and this is 90, this is 70, this is 50. Very objective judge is possible. This is my patented. Okay, you can see the patented. And then the patented means the subject is pain detector and the measurement device using high voltage. That is patented. And my book about the Archotherapy, high voltage operating therapy. So cell charging, healthy life for the people. I wrote this book. Number 9, indication. All sorts of pain can be treated. And the fracture feeling 3 times faster, abdominal cramp, headache, and then vision, macular degeneration, cataract, glaucoma, and then ear, hearing, tinnitus, vertigo, and then immunity increase, viral infection decrease, and then also to musculoskeletal disorder, muscle pain, shoulder pain, nerve disorder, facial palsy, or CV palsy, CRPS, or stem cell graft survival rate increase, skin condition and skin disease become normal, anti-aging effect, nerve regeneration, all kind of degenerative disease, lymphedema, swelling. So many indications there, but we can think, in my experience, the most powerful control. The effective treatment indication was sciatica, and then the shoulder pain, and the neck pain, muscle pain is the best treatment. And another one needs a long time repetitive therapy, long time. Number 10, how to apply ELCURE therapy. So you can apply the ELCURE therapy, keep the patient supine position or prone position, and then keep dry skin, because electricity is propagated or passed, it didn't go deep. So dry skin is best, and then the probe and keep dry air. So air conditioner is necessary in the treatment, and keep good insulation. The patient do not touch any metal part or the pipeline or something like that, and good insulation under the blanket or under the table, and then check the trigger point likewise. Check the trigger points, like a probe like this. Probe looks like this, and then where is the trigger point, and then point it, and then apply the electric cure by contact the skin, and the one trigger point is 1 minute, so pain decrease by time. And then after one point treat, and the end of move on to the point here, 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 or back or knee or like that. So average treatment session is around 20 minutes. And why, when I touch the probe on the skin, that is ionizing pain during the charging. Ionizing, what is ionizing? Lymph sludge is ionizing. So lymph sludge is dissolved when the target lymph sludge and then dissolved, and ionizing pain develops. There's a pain, contact like that, but it decreases within a few seconds. So electric current go through first the blood vessel or through muscle or nerve and cellular level, and it arrives to the cellular level, and then it becomes pain-free. After treatment, 20 minutes after treatment, it hurts so much I cannot move it, but after 20 minute treatment, I can move it freely. No pain, much easier. Then that is the ELCURE therapy. And then it makes electromagnetic field like that. There's a focus to the trigger point, and then it become trigger point is the maximum electrofriction point. Then put the probe here, and then when charged, it becomes the pain subsides immediately. So that is one charging is not enough. So charging, discharging, charging, discharging, charging, discharging, and charging, discharging. And then after the cell itself can make electricity in the mitochondria, then pain subsides, pain go away. So treatment sessions showed acute pain is 20 minutes, and then every 2 days or every week. Chronic pain need more time and then need more sessions. I recommend 10 to 15 sessions. 10 sessions every week means 2 months or 3 months treatment every week. So repetitive treatment is very important. Case study. This is I gave lectures at Chicago 2016 in United States, lymphedema patient workshop. Okay, you can see the left side that is a swollen ankle, then immediately after treatment, swollen go away and become red color. They increase the microcirculation. The below photo shows also same result. So electrode dissolution of edema. This is Fisher Porsche patient, and then before treatment, she is forced the left hemipace, and UE is very, very difficult on left face, and she cannot close eyes effectively, and then he make wrinkles on left side is not possible. UE is a Porsche. And after treatment, you can see E Ooh. And closing eyes is much more easy. And then making E also ooh, also nearly normal. Yeah. Then another case, diabetic foot is HbA1c is very important marker of the diabetes. And then you see that is a necrosis and become red, it become black skin and then scabs like that, and they become black colored skin, and then it recovered completely after 4 months treatment. 4 months means 16 times treatment every week, once every week, and then 16 times. And then you can see the HbA1c starting time is 12. But now is 6.6. It's become normalized. And then you can reduce the injection of the insulin also. So this is very, very important result. And if you have a very severe, very heavy diabetes, and you can apply to the pancreas, to ELCURE therapy, and then HbA1c can be lowered. Blood sugar can be lowered. That is the very unique phenomenon, very interesting result, clinical result. Another one is herpetic pain. Shingles is more easier terminology than in American or something, and then shingle pain is very, very severe. But he becomes maybe he is 72-year-old male patient, and then become so many eruption and very severe pain, and they come to me, and then I treat him every 3 days, and then within 2 weeks the pain decreased, and then scabs go away likewise. Number 12, summary. ELCURE therapy is very, very effective in the pain control, more faster and more powerful effect than traditional Chinese medicine, acupuncture, or something like that. And the ELCURE has a much longer effect than TENS. And then activation of cellular regeneration and the nerve regeneration effect we can get, and enhanced blood and lymph circulation, and immediate reduction of swelling, and the long time use, anti-aging effect, enhanced skin tone, and then post-management of cancer patients can apply the incurable disease, various disease. And then the requirement before ELCURE therapy, I recommend my patient stop all medication, please. Especially stop all analgesics. Blocks the cellular communication, and the analgesics are making lymph sludge very thick. So stop. But you can take hypertension or diabetics or hyperlipidemia. You can take the drugs. The metabolic disease. ELCURE therapy is giving electrons to the cell, but the steroid still completely different concept of treatment. So avoid the steroid injection, and good insulation during patient therapy. During patient therapy, good insulation. Good insulation means the electricity go to deeper tissue. If you have a facility between your neighbor or something inside your clinic, recommend lymph detox. Lymph detox is getting rid of lymph sludge by another method. And then recommend alkalizing food, and recommend MV75 patch. MV75 patch is not drug, it's a medical device giving the electricity outside to the deep tissue. It's just like the patch. So advantages of ELCURE therapy is ELCURE can read your cells heal by themselves, without any medication, via supply necessary electricity from outside using ELCURE device. Just the contact to the skin, and then your cells become vivid. So auto healing is the best cure. No side effect. Stop drugs, stop analgesics, avoid steroid. That is the main advantage. ELCURE looks like this. Thank you very much for your attention.